Greg, please go ahead whenever you're ready.
Hi everyone, thank you very much for having me. My name is Greg Rawlings. The title of my presentation is Online Mental Health Resources and Peer Support. So just to introduce myself in case you don't know me, so say my name's Greg. I have degrees in psychology from in the UK. I have a PhD in neuroscience. I am a qualified clinical psychologist. I work 2 days in the NHS working with adults with a learning disability and 3 days as a lecturer in clinical psychology at the University of Sheffield. And that's where I do my research in regards to PHA, PHRI. So I work with colleagues at Sheffield Teaching Hospital, which is a PH Specialist Centre, as well as PHE UK. So this is my second time presenting at the webinar, so thank you for having me again. So I presented it a couple of years ago where I discussed our work looking to develop a self-help guide, a remote guide for anxiety and pulmonary hypertension. This is a self-help guide that can be completed in the comfort of your own home. It's based on a type of treatment called CBT, or cognitive behavioral therapy for short, and as I say, it helps people with PH manage anxiety. So if you're interested in hearing more about the program, there's a YouTube link underneath, and then if you're interested in the program, there's the link above. And I suppose the reason for that work, or one of the things that helped reinforce the need for it, is this review that was published a few years ago, looking at rates of anxiety and depression in pulmonary hypertension across North America, Europe, and Asia. And it involved over 2,000 patients. And what they found was that rates of anxiety and depression were much higher than what we'd expect to see in the general population. So it was around 37% for anxiety and around 28% for depression. So for comparison, we'd expect to see around rates of 5 to 6% within the general population. So much higher in people with hypertension. This graph in the review is particularly important, at least in my view it is. So this is looking at predictors of anxiety and depression in hypertension. And I just wanted to draw your attention to the information in this red box. So this is looking at severity of PH symptoms as indicated by the Q functional class. So this is the idea where functional class 3 and 4 is more severe in terms of symptoms compared to 1 and 2. And what you'd expect to see is that WHO functional class, so severity of PH symptoms, is significant predictor of depression and anxiety, when actually that's not what we found. So for it to be significant, these values here would have to be less than 0.05. So this would suggest that treatments that aim to address the severity of pulmonary hypertension as measured by WHO functional class system maybe not the most helpful. There's something else going on here that might account for why rates of anxiety and depression are so high. The way that we can measure symptoms of depression is using screening tools, and these are self-reported, so they can be completed anywhere, so in clinics or via apps or online. And this is one of the most common methods of screening for depression. So this is 9 items that someone would respond to over the past 2 weeks, looking to see how often they experience some of these symptoms related to depression. And then the score can help us to understand whether they're likely to experience depression or not on the clinical level. It is only a screening tool, it's not a diagnostic tool. However, it is a relatively easy measure to administer and complete. Some of you may be aware, someone's already mentioned the global PH survey that was published this year. So this was a survey involving over 3,000 patients from 88 countries. And then on the right-hand side, you can see the percentage of people who experience or who endorse some of these experiences. So 27.5% of people reported low self-esteem, 26.5% reported anxiety, so fear, and so on. And this led the authors of that paper, of the survey, to conclude that psychological support is a highly requested but frequently unmet need, reinforcing the importance of holistic care models for multi. So recognizing that rates of anxiety and depression are high in this population, recognizing that there's multiple barriers to accessing support, we've already developed a resource to help anxiety. So what we've done recently is develop a resource that people can complete at home with self-help based on CBT targeting depression in pulmonary hypertension. And these papers, this paper is now published, and the resource is available. I'll share the link later on. And what this resource is looking at is it's 4 booklets over 4 weeks. and each booklet corresponds to different topics. So the first one, for example, is looking at depression and chronic hypertension. So this is helping people to understand symptoms of depression and how it might interact with PH. Moving on to week 2, booklet 2, which is looking to replace inactivity. So this is a key aspect of CBT for depression. It's known as behavior activation. So it's around helping people to change behaviors in the hope that it will help improve mood. And then what we might find is that feeds into more positive cycles. So what we've done is we've tested this intervention. So as I say, it was self-help, so people could complete it at home. We had 68 people take part, and we randomized people to one of 2 conditions: one where they received the intervention, shown by this blue line, and one where they're in the control group. This is where people were allocated to a wait-list condition, so they didn't receive anything. We assessed depression before the intervention, after the intervention, so only 4 weeks later, and at 1 month follow-up. And we asked people to complete PHQ-9, which I showed earlier. This is what we found. So both groups scored moderate depression, and using the PHQ-9, we can look at the clinical cutoff. So this means that anyone scoring above this cutoff may benefit from speaking to a healthcare professional and receiving additional support. But what we found after the intervention was those in the CBT group reported a reduction in their difficulties related to depression, and then at 1 month follow-up, that was maintained. We also asked people who took part to complete the Emphasis 10, which is a health-related quality of life measure. It's 10 items asking around difficulties related to PH, or particularly around breathlessness, for example, or fatigue, or some of that other psychosocial impacts. So PH does not control my life, I'm independent, I never feel like a burden. Those were some of the questions that people answered. And again, we asked them to complete the baseline, post-intervention, and follow-up. And as you can see here, those in the CBT group, interestingly, didn't score much difference in terms of baseline and post-intervention. However, at 1 month follow-up, they scored an improvement, and this was statistical improvement. We obviously have to bear in mind that it is a relatively small sample size, so more research is needed, but nevertheless, the evidence is promising. So, as I say, our intervention shows promising research that can help with depression symptoms, but also help with quality of life. We also asked people what they thought about the intervention, and the majority valued that it was specific to pulmonary hypertension. The majority reported feeling more in control of the depression. As I say, relatively small numbers, so 15 people responded, but nevertheless, still promising data. People with pulmonary hypertension thought that other people with PH should have access to the intervention. A similar amount said that it helped them a lot, and they'd recommend it to others. And there's some quotes there. So people are talking about how the self-help intervention give useful strategies to help maintain my mental health and make sure I'm doing what I need to support my physical and mental health. So as I say, just like the anxiety intervention, the depression intervention is now widely available via PHA UK. And as I say, you don't need to access this through your PH provider or PH service. This can be accessed remotely. And this also contributes to the other forms of remote support that PHA UK offer, so namely the listening line. So this is a telephone line where patients with pulmonary hypertension can ring and receive support from someone with knowledge of pulmonary hypertension. It's not counselling or therapy, but it's someone with expertise in pulmonary hypertension. In addition to PH Connect, so this is an online platform where people impacted by PH can access and find other people who have shared experiences, so whether it's to do with medication or type of PH or gender or age or ethnicity, and reach out, and that's where you can have that connect and that peer support. So as I say, we've developed a resource for anxiety, resource for depression, and they're both remote and can be accessed by self-help. What we're currently developing at the moment, and the interventions developed, we're just in the process of making it available, is we are looking to test an intervention that we've developed looking at sleep in hypertension. And this comes on the back of our research, but also some other research looking at the high rates of sleep difficulties in PH. So, for example, recently we interviewed 111 adults with hypertension. We asked them to complete validated measures of sleep. 80% were classified as having poor sleep quality, and around a third reported difficulties with daytime sleepiness, and around a third report clinical levels of insomnia. So our intervention looking at sleep will be available again with the aim of being remote and self-help. Thank you very much for your time. Thank you for having me again. I'd like to thank everyone who's took part in our research, in addition to PHA UK and